At the Missouri Orthopedic Institute, we're developing the next generation of treatments to improve the way you move. Not only does the Institute provide a full range of care inside, but our physicians are working with leading scientists outside across the University of Missouri campus to develop new technologies that go beyond restoring health. You don't have to be an elite athlete to learn how to move better. At the Missouri Orthopedic Institute, we're using some of the latest motion capture technology to help us pinpoint our patients' exact needs. By capturing hundreds of details with this new DARI system, our therapists can design a custom treatment plan to get you back on your feet faster, or just back into what you enjoy doing the most.
At the Missouri Orthopedic Institute, we found a whole new way to track how you move and help you move better. We've taken some of the special effects technology used in Hollywood and now are using that same type of precision to help our patients with a new motion capture analysis system called the DARI. Named after the company that designed it, our DARI motion capture analysis system is the first system of its kind to be used in a clinical setting in the world. Motion capture systems are nothing new in the physical therapy and rehabilitation world. They've been around forever, but the problem is they're fairly labor intensive. They require the patient to wear a special suit and the therapist to painstakingly place markers accurately on each joint. With our current system, we can run 10 to 15 patients through the system in an hour. The old systems where markers are used, you could only do about 1 per hour. By capturing real-time data, the DARI gives us a more precise diagnosis of your problems, and it does this very quickly because we're not using the traditional techniques. In a few short minutes, we can capture hundreds of details about how one person moves. Anything you can do in a 20 by 24 foot space, we can track, and the system creates a skeletal model of your body and how your body is moving. The DARI uses 14 different infrared cameras to capture your body in motion and provide data on how you are moving in 3D. The system tracks and produces a picture of how joints and segments are moving throughout the body. If a patient comes to us and performs even a simple movement like a standing squat, the DARI gives us a host of data about that movement, such as showing range of motion and joint reaction forces. Through various mathematical calculations, the DARI can map out where the joints and bones are inside of your body, and that's how it's able to capture how your joints and your body segments are moving. Through this, we can look at symmetry, movement restrictions, and functional imbalances. Armed with this new information, the therapist can then design a completely customized treatment plan to correct these problem areas. One of the things we plan to do with the athletes is functional baseline testing at the beginning of each season. With that baseline information, we will be able to better detect potential breakdowns in function. We can also use this baseline testing to help us in the event of an injury to help determine return to play. But it's not just about getting back on the field, it's about getting back into life and the activities our patients enjoy. Whether it's from a range of motion standpoint to becoming stronger or just functioning better, this system helps us gather the information we need to pinpoint and treat our patients' problems. And we're the only clinical setting in the world to be able to do this for our patients.